Central Steering Group, Mr. Ma Xiaowei, and he's also the Minister of the NHC. Mr. Yu Xujun, member of the Central Steering Group and Vice Minister of the NHC. Mr. Liang Wannian with NHC. Yes, Zhao Yahui from the NHC. And they will be briefing on the Central Steering Groups in guiding work related to epidemic control and medical rescue. Today, let's first give the floor to Mr. Ma. Friends from the press, good afternoon. The outbreak of COVID-19 is the fastest transmitted and infectious disease that affect the most population and most areas. And it's a public health emergency of international concern. And headed by General Secretary Xi Jinping, as well as the State Council and Central Party Committee, and the instruction of Premier Li Keqiang also visited this affected area under the commission of Central Party Committee and General Secretary Xi Jinping. Premier Sun Chunlan have arrived at Wuhan. On January the 20th, she's been leading the efforts in control the epidemic and conduct medical treatment, and made scientific judgment to improve infection rate and fatality rate, and reduce fatality rate and improve recovery rate. There are many important decisions deployment made by the Central Steering Group, and efforts in all fronts to improve the containing measures has been carried out and implemented. And we are now seeing positive momentum to the prevention control. To address the community transmission problem, we have conducted the screening at the community level and improve the nucleic acid test speed. The steering group have carried out this categorized treatment of fever patients, suspected cases, close contact, and confirmed patients. We have also deployed thousands of personnel to begin their work in Wuhan to carry out epidemiology investigation. The government and the local government, as well as third parties, are making their own contributions to this. We've chosen 3 labs to conduct the testing, and the personnel in these labs also are in charge of training of personnel in other localities. The capacity to do the nucleic acid test is improved from 300 a day to 20,000 a day. And the time to do the test is shortened from 2 days to 4 to 6 hours, so that we can test all of those that should be tested and realize speedy testing. We also work make endeavors to increase hospital beds numbers, and a month the beds to treat the patients have increased from 5,000 to more than 23,000, among which 9,000 are dedicated to severe cases. With the joint effort of governments at all levels, many museums and exhibition centers, as well as stadiums, were transformed into temporary hospitals and isolation spots. 16 new temporary hospitals were built, and they have opened up more than 12,000 beds. And on a daily basis, the discharged patients' number have overpassed that of the newly increased cases. In order to address the resources shortages, we also have transported medical supplies from all over the countries. There is a large number of severe cases and the confirmed cases, which is a great pressure to the hospital capacity because they are infectious disease patients. They cannot be transferred to other provinces. So that the pressure is hard to be released. That's why we have sent medical workers from all around the country. Altogether, we have sent more than 40,000 teams from 330 medical teams. Many of them are experts in CCM, respiratory discipline, and internal medicine. And this group of people amounts to 16,000. Many of them are very senior experts in their expertise. To address the shortage in medical supplies, we also coordinate the needs and connect them with demand. The hospitals have been collecting the much-needed ventilators and ECMO, as well as protective gears in support of frontline medical workers. The national medical teams, in particular, well, 1 week before their arrival, most of the medical supplies were provided by their home hospitals so as to guarantee that upon arrival, the medical worker can begin work instantly. Now, to reduce the fatality rate, we have strengthened efforts in treating the severe cases in Wuhan. The medical teams have been taking over hospitals and even disciplinaries. Altogether, the 9,000 beds have been given to 7,000 severe cases, and we are now at the 6th edition of medical treatment. We also have conducted the experts' consult as well as the rounds of severe cases. We also promote the clinical uses of TCM. Through the measures that I mentioned above, the severe cases in hospitals this recovery rate has been increased to 14%, and more than 30,000 patients have already been discharged. After our endeavors, we have stabilized the trend of the epidemic and is now turning into the positives. According to the officials of WHO, China have taken unprecedented public health measures against this epidemic, and they've been proven to be effective in terms of curb the transmission as well as people-to-people transmission. The State Council made the decisions based on the big picture of economic and social development and made the decision to coordinate this economic development with that of epidemic control. So now we are transforming from static measures to a more flexible measures, from unified measures to more region-specific measures, from unified control to more targeted control, which is a higher demand to the health system of our country. We fully understand that today's achievement comes at a great cost. Today we are facing a lot of challenges and risks due to the restoration of productivity and the commencement of schools. So we cannot relax for a moment because we know that medical workers have to hold the defense line in Hubei, and the final battleground, that is Wuhan, Hubei, and we cannot go back. We have to stand our ground in order to guard against rebound possibilities. Behind Wuhan and Hubei are the 1.4 billion Chinese people and 7.5 billion people all over the country that are susceptible. So it is the medical workers' responsibility to stand up to the task. Coming up, we will continue with our efforts to conduct prevention, control, and treatment. We will guide the localities to propose more flexible control and treatment plan that is catered to their status quo. Hubei, Beijing, and other provinces and regions have begun with the differentiated measures against this epidemic. And we will categorize the country into low-risk, mid-risk, and high-risk areas. We will make more specific and more programmatic measures and work out plans for implementation. We will strengthen the accountability mechanism for enterprises and schools, and as well as institutions, so as to provide a more technical guarantee for the restoration of work and study. Technically, we will also realize this daily clearance of newly discovered cases to make sure that all the patients are admitted and the cases are tested. We also attach importance to the treatment of mild cases and prevent them from deteriorating. For the severe cases, we also need to stick to the four commitment. First is the four combinations: the fundamental medicine and the clinical trials, the treatment of the frontline and the backups, and so as to realize and showcase the advantages of the technical edge that we have. Now the floor is open to questions. We'll still do this through telephone and video conference systems. Please identify yourself first. With Xinhua News Agency, from the current released statistics, the number of severe cases remains large. What are the measures that are taken to reduce fatality rate in treating these severe cases? The outbreak of the COVID-19 compared to SARS has a stronger ability to transmit. There are a lot of mild cases, but there are still a few cases that are proven to be very severe. And many of the death cases have chronic diseases of their own. For example, heart diseases, cancer, or organ failures. There are also some young patients that are experiencing a lot of very heavy syndromes. Despite our shallow understanding of the pathology of such disease, the damage of this disease to the organs is still consistent with our common understanding in medicine. So it's important for us to lighten and ease the symptoms of these patients. So we take this collective treating measures, the collectively treat the patients and give them collective treatment. And so in Wuhan, we have established 11 designated hospitals that provide more than 9,000 beds. In these hospitals, there are 19 national and provincial level medical teams. consisting of 13,000 high caliber medical workers that are working aside the local medical forces. And the following three aspects. First, to make more targeted treatment plans. In clinical treatment, we have begun our pathological studies. We have discovered the main part of the damage and the degrees of the damage, so as to further identify our direction of treatment and have proposed treatment measures accordingly. And we have made this decision on the treatment plan, and the wide consensus were reached among the experts. Second, to carry out more creative treatment plans. We need to identify the severe cases and at an early stage. The main contradiction in treatment is the jam in between the organs, and we need to take creative measures to make use of the best time possible to shorten the treatment period and elevate the patient's condition. Currently, we have this intubation team to carry out invasive ventilation for the patients. This is crucial for saving lives. In the treatment of the severe cases is one of the most precious experiences that we have gathered. Third, we need to collectively gather the experts and strengthen on their coordination, as well as the sharing of experiences. So we need to study on immunology, pathology, as well as the autopsy of the patients. We also need to strengthen this online consult service and platform. In the past, this kind of support mainly happened when it comes to the supply of medical materials. But right now, this kind of coordination mainly is about this online consult between experts in different places. We also have strengthened our capacity in terms of ICU treatment and nursing abilities. That's why we have to establish this SOP in terms of nursing in ICU, so let's make sure that each patient is being taken good care of. Third, to combine scientific nursing with the management of the ward zone. We have established teams of experts to streamline the process and establish SOPs. In cities outside Wuhan, the experts are doing rounds in designated hospitals, especially those that admit severe and critical cases. We have gathered many important experiences, and the 6th edition of Treatment and Diagnosis Plan was already issued by the NHC, and as of now, more than 78 have been recovered, and more than 36,000 have been discharged. We need to propose the China measures or China's medical plan in terms of treating COVID-19. With the development of clinical practices, we are gathering more experiences that will, in turn, give the medical workers more confidence. Currently, the newly confirmed cases in Hubei and Wuhan is decreasing, and the WHO reckons that it has reached a peak. But according to the steering committee, it has not come to a turning point. So how do you comment on this phenomenon? We'll give these questions to Mr. Liang Wannian, please.
好，谢谢。那么疫情发生以来啊，我们
Since the
一直在
outbreak,
组织
we have been organizing experts of many disciplines,
流
including
行
public
病学
health
卫生应
and
急、法学、
law,
社会学
medicine, infectious
经济学
disease, and
等等，
sociology,
还有临床学
as
的
well
专
as
家，
economics
一
and
直
clinical
在
medicine
跟踪
to follow
研
up
判
the trend, the
疫情的发展
development of
形
this
势，
epidemic.
同时呢，
At the same
在
time,
做风险
we're
评
also
估。
doing flight checks,
那么专家们
flight
通过风险评估
evaluation.
和形势的
Through
研
these
判，
studies,
那么一致
the
认为，
experts have come to
那么这
a
次
consensus
疫情
that
的
prevention
防控
control
从策
of
略
this
上
epidemic
是正确
is
的，
strategically
措施上
right, and the
是
measures
果断
were
和有力
decisive
的，
and
并且
effective.
也取得了积
And
极
we
的
have
成效。
already
和
seen
明
some
显的进展。
positive results
那么
and
它主要表
development.
现在避免了在中国
These measures
更大
have
范围的
effectively
疫
prevent
情的爆发
further
流行。 那么
spreading
全国
of
的
this disease.
疫情态势持续的向好，
And the situation of the whole country
那么
have
呈
seen
现
positive
向好的态势
development,
正在逐步的
and
拓
the
展。
scope of
这一种
such
状
an
态。
improvement is
那
also
么我
expanding.
分几个层次和地区来介绍一下疫情
Now
的
let's
情
take a
况。
look at some of the
Wuhan
specific examples. The city of
它是
Wuhan
这次疫情的
is the
一个中心，
epicenter of
也是
this
最严重的地区。
disease, and its most effective
它目
region
前
as well.
疫情快速流行上升的趋势，
Currently, this
已经得到了遏
fast
制。
development of such
它
a
表现
disease
在
has
新增
been
的
curbed
每日
in
病例
that
数，
the newly
新
confirmed
增的
cases
每日的
and
疑
the
似病
newly
例数，
increased suspected
以
cases,
及近期以来它的重症、
as well
危
as
重
the
症比例
percentage of severe and
在
critical
确诊
cases
这个病人的比例在下降，
is decreasing, are all decreasing.
病死
The
率
fatality rate
在下
is
降。
also decreasing.
这四个数字
These
就
four
充分地表
trends
明
is
疫情
very
正在
clear
得到有力的控制。
evidence that
我这
we
里
are
有一组
getting the
数据。
situation under control.
比如说，这个每日新增的确诊病例数
New
最高峰的
cases
时候是2月
has
13
reached
号，
its peak on
达到
February the
3900
13th, which is
那么下降到 2月27号
3,900.
313，
And as of yesterday,
那么
it
新
was
增的自愿出院病人数
313
从2月
patients
20
discharged.
号就开始连续8天
Has also
超过了
been
新增的
surpassing
确
the
诊病例
new
数。
cases for
这是一个
8
非常
days
好
in
的
a
一个
row,
信
which is
这个
a very
情况
positive signal.
就是进出不仅达到了
We're
平
not
衡，而出院数超过
not
了
only reaching a balance
新增的
between the
确诊病例
confirmed
数。
and discharged,
现有的
and
重
the
症病
number
例
of
占
the
比，
discharged
也就
has
是重症病例
overpassed
占确诊病例的
that
比
of
例，
the new cases.
从2月
In terms
11
of
日
the
的
percentage,
31.6%，
it has decreased from
那么一直在
31%
持续
on the
的波动
11th.
下降。那么到27号的时候，只达到22.4%，
And
和重症
there
比在手，
were some
病
fluctuations.
死率从1月
And
26
in
号
terms of the
最高
fatality
点
rate, it
9.01%，
has been decreased
下
from
降到现在
9%
的
to
4.4%。
4.4%
那么
as
同
of
时呢，
today.
还有一个比较好的情
Another
况
good
是，
trend
在每日
is
的
that
新增病例当中，
in
我
the
们
daily
进一
new
步分析
cases,
这些新增病例主要是有
most
疑
of
似病
them
例
are
转过来。那么这种
confirmed
比例
cases from
占
the
80%
suspected
到
cases,
90%，
which accounts for about
也就是说这些
80
病
to
例实际上都是在我们
90%
掌
of
控
all
之
the
中
confirmed cases.
来
That
进
means
一
that
步
most
确
of
诊
these
过来。
cases
这
are
是武汉的一个
already
基本情
kept
况。
in
湖南
quarantine.
省除武汉以外的其他地市，那么我们的
In
研判
places
发现呢，
outside
它的
Huben,
局部
we
爆发
have
的
found
这种态
that
势
the outbreak
得
of
到了遏制，
this disease
这是我们的一个基
i-
本的判
is
断。
effectively
就湖北
curbed.
除武汉以外的
That
地
is
区，
in cities
它有几组
outside
数据
Wuhan.
来
In
证
Hubei,
实这个情
there are
况。
several numbers as
就是
well.
每日新增的
New
确诊
cases on a
病例
daily
数
basis has been decreased from more than 1,400 on the 12th to 5 today. Newly discharged patients has been increased for 15 days in a row and has been surpassing this newly confirmed cases for 15 days in a row. The percentage of severe cases is also remaining stable. On the 27th, the number is 12.9%. Fatality rate is decreased and has been remaining stable. As of yesterday, this number is 3.1%. That is the cities in Hubei provinces except for Wuhan, outside Wuhan. In other provinces and regions outside the province, their situation is also very positive. The new cases is decreasing. The peak happened in February the 3rd, which is 890, and today it's 9. Patients discharged has been decreasing from the 12th for 16 days in a row, which is also surpassing the number of discharged patients. And the percentage of severe cases remained stable. Right now it's about 12%. Fatality rate is stable to 0.5% to 0.8%. Yesterday, there were 22 provinces and regions that did not report any confirmed cases. This is the basic situation right now, but according to the panel of experts, zero growth doesn't mean zero risks. We are still facing daunting tasks and complex situation in front of us. There are still a lot of uncertainties, and we are facing rebound risks. So we cannot relax, cannot lose up the control measures. As of now, nationwide, Hubei province and Wuhan city are still the epicenter. Provinces outside Hubei must also guard against possible rebound, especially with the increase of mobility, the restoration of production. There might be rebound risks in some places. So coming up, we still need to prioritize work in this regard while balancing economic and social development with the containing of the virus. Strategically, the city of Wuhan would still have to continue the containing of the virus in the city and prevent the cases from spreading to other places. We need to specify the measures, including strict control of the access to leave Wuhan and strengthen community-level control and the 4 collectives in order to reduce the fatality rate and increase recovery rate. We should also strengthen treatment of mild cases so as to prevent the possible deterioration of these cases. In places outside Hubei province, measures must be taken to prevent the export of the cases and internal transmission, and carry out the management of 4 categories of patients, and to have better management of the access to leave Wuhan and Hubei. The other provinces must guard against import cases and regional spreading. At county level, we should be making categorized policies according to the risk level of low, mid, and high, in order to better balance the socioeconomic development with the prevention control of the epidemic. With Bloomberg, more than 40,000 medical workers come to Wuhan's and Hubei's rescue. So what are the work that are done by these medical teams? And what kind of role do these people play in treatment, and we will increase the number of medical teams, and do you have considerations for short breaks for these medical workers? Wuhan is the priority in terms of treatment, and the victory of Wuhan means the victory of the province and the whole nation. But right now, more than 40,000 medical workers have come and arrived at Wuhan and Hubei. There are many work that are worth remembering and many experiences that needs to be taken record of, and many stories to tell. I will refer this question to Ms. Zhao Yahui. Hubei and Wuhan are the main battleground against the disease. In order to meet the temporary demand and the understaffed contradiction, from January 24th, the NHC began to send medical teams to Wuhan and Hubei, during which we have done the following work. First is to arrange the medical materials in a plausible and reasonable and scientific way. We need to strengthen treatment of severe cases, as well as the treatment of the mild cases, and the teams have been divided into different functions. For those that are in charge of severe cases, most of the personnel are from infection and CCM and ICU departments. And in each ward zone, 50 beds are provided, with 30 doctors and 100 nurses. In terms of the treatment of the mild cases, most of them will be working in temporary hospitals. So per 1,000 beds, 500 personnel are arranged, with 100 doctors and 400 nurses. Most of them are internal physicians and nurses. Second, in terms of the treatment of severe cases, most of the medical workers are working in designated hospitals, so that a whole team can take over an entire zone for infectious diseases. And we have established a temporary commanding center and panels of experts to conduct evaluation management of all the severe cases. The QC mechanism and systems are also playing important functions during wartime. We also have organized and integrated the mild cases medical teams with the P3 labs. And we also have conducted this kind of contracted administration and have organized standardized treatment and nursing units in order to expedite the construction and medical resources allocation. Fourth, we also have sent teams to replace the working teams. During this rotation, according to the instruction given by General Secretary Xi, we have to take good care of the medical workers so that they can dedicate themselves into this battle in a sustained and long-term manner. We have now been taking many measures to do the rotations of the medical teams. Measure number 1, to strengthen this rotation scheme inside the medical teams. As of today, we have 2,600 patients that are still hospitalized, among which 6,600 are severe cases. We have 26,000 patients that are still in hospital and 6,600 are severe cases. The number has been reducing for several days in a row. That will allow us to reduce the hours of shift and increase the number of medical workers during each shift. Second, we also conduct this rotation for the first groups that have arrived in Wuhan. For example, from Guangdong and Fujian, the medical teams are now taking their breaks as a whole team. 3, we also reorganized some of the medical teams, the newly arrived medical teams, and have assigned them to the existing teams so as to improve the manpower in these teams, so as to allow more time for the medical workers to take breaks and to conduct shifts. Right now, if you work for one day, a doctor can rest for 1 to 1/2 of a day. And if a nurse works one day, this person can take 2 to 3 days of rest. And currently, they're working 25 to 30 hours a day. And for nurses, their working hour has been reduced from 40 hours a week to about 20 hours a week. So the rotation of the medical forces can empower our teams and make sure that they can contribute to this fight in a more sustained manner. Our medical teams have been playing important functions in this endeavor.
I am a journalist from Pakistan. WHO evaluates China's measures as effective, but does not rule out the possibility of rebound. There is a still big risk in fighting this virus. Now, more and more people are going back to work and factories restart production. How can China prevent the epidemic from rebounding and control the risk? 谢谢。
好，请把问题翻译一下。
巴基斯坦记者提问：世界卫生组织评价中国的措施是有效的，但不排除疫情反弹的可能性。我们面对这种病毒仍然存在巨大的风险。现在越来越多的人返回工作岗位，工厂也开始重新运行。在这样的情况下，中国怎样防止疫情反弹？怎样控制风险？谢谢。
这个问题呢，应该说是我们防控的工作中当前面临的
Currently, that is an important question that we are facing. We have a special deployment as to this question. Now, we'll give the floor to Mr. Yu Xuejun from NHC to take this question. That is indeed an important question. As Mr. Ma said, it's something that we are doing right now. Before taking your question, I also want to interpret some of the policies. despite the fact that the WHO gave high comment and praise for the work that we've done, but we are very cool-headed as to understand that we are still faced with very complex situation. There's still a risk of rebounding. Many provinces have turned down their level of emergency response, and some rightly so, according to the law on the prevention of infectious diseases and other regulations concerning public health. We need to make more specific measures and more targeted prevention and control measures in different regions. The level down of the emergency response also means that the level down in control measures and the restoration of work and study also means that more people will be returning to schools or returning to work. So that constitutes challenges for us. First, during transportation, there is an increasing risk in prevention control. Second, there is a risk of collective or cluster transmission. In Guangdong, Jiangsu, and Zhejiang provinces, which are main labor exporter, there might be a rising risk as to the containing of the COVID-19, which constitute bigger challenges and higher demand for us. I first want to mention that we are fully aware of those risks and we have been taking measures against them. We ask that the provinces make plans and carry out drills to conduct scientific handling of these cases during the restoration of work and study. Still, the principles of treating infectious disease, early identification, reporting, isolation, and treatment. Report must be compiled in a timely manner in order to discover all the potential cases, and the epidemiology study must be strengthened, and we also need to realize 100% admission, treatment, and quarantine. The restoration of the work and study also means that we need to adjust our preventive measures in a timely fashion from the following three aspects. First is the transmission from static administration to flexible transmission, from unified requirement as a country to regional measures, to social control, to more targeted control measures. We need to guard against possible rebound risks, and we have made overall deployment of work in many aspects. First, the categorization of the personnel according to relevant documents. We need to strengthen the health monitoring of the employees and take effective control measures, guide the employees to take timely measures once there are abnormalities. And second, strengthen control measures in transportation, ventilation, disinfection, as well as body temperature checks are essential. In the labor-intensive enterprises or cities, this returning of the labor forces need to be organized so as to prevent over collective or gathering of the population. in hospitals, schools, nursing homes, as well as among the vulnerable groups and the rural population, we all have made specific instructions so as to strengthen the accountability mechanism at different localities and promote the implementation of the control measures. Fourth, to strengthen technological guidance and education and publicity of the information. We have issued 15 targeted and highly operable technological plans that covers the measures in community, schools, and enterprises, so as to publicize the much-needed knowledge to the general public. Coming up, in order to ensure the restoration of production and steady and prevent the disease from further spreading, the steering committee will also urge the localities to report on their preparatory work, and we will also be carrying out the supervisory functions. If there are consequences that with the rebound consequence due to more practices, we will hold the relevant people accountable. During the prevention of the disease, the temporary hospitals is an important step. So how many temporary hospitals are there, and how many patients have they taken, and what functions do they play? Since the outbreak, there is a drastic surge in terms of the medical demand. There are a large number of patients that were not admitted because the hospital beds are not enough to take in all of these patients. We are facing pressure, mounting pressure in terms of the further transmission of the disease at the community level. Under such a difficult situation, Vice Premier Sun Chunlan, after arriving at this location, have led the decision to establish temporary hospitals that are renovated from stadiums and schools and exhibition centers. And the mayor, Mr. Zhou Xianwang, also led the effort in the construction of these hospitals. And our cadres at different levels also stand at their positions to make sure that this measure is effectively implemented. And the first batch of temporary hospitals with 4,000 beds only takes 29 hours to complete. And then 22 medical teams were assigned, and 3 mobile nucleic acid test cards were assigned. More than 8,000 medical workers began their work in this temporary hospital in just a few days. So the construction, the admission, and treatment actually take place simultaneously. And altogether, we now provide 13 beds from these hospitals, and altogether 12,000 patients have been admitted. 1 in 4 of the patients in Wuhan are treated in temporary hospitals. So right now we realize that 0 deaths, 0 infection, and 0 returning of the patients. Currently, we have on a daily basis 5,600 beds to spare on a daily basis. Looking back, the building of these temporary hospitals is an important strategic step that we have taken, and during which we expanded these medical resources by a large margin in a short period of time. Otherwise, if a large number of patients cannot be hospitalized, they might face the risk of deterioration and further transmission at the community level. It is hard to imagine that if we did not admit these patients in 2 to 3 days, we will be facing more daunting tasks ahead of us. It was at that critical moment that we made such an important decision to build these temporary hospitals that play important role in prevention and treatment, which also serves as an excellent example if we have to face another epidemic of a similar scope. The wider application of temporary hospital is a signature movement in the medical history. We are able to do this because of the strong leadership of the party and the government, the joint synergy of all the medical workers, as well as the support and understanding of all the residents and patients. My special thanks goes to the patients and the residents. It is because of your support that we can maintain this very good relations between the patients and the doctors. And there are also temporary party committees that were organized in these hospitals.
好，请继续提问。
According to the General Secretary, it's important to win this battle in Wuhan and Hubei, and prevention and treatment are the two priorities. We have to move the important juncture ahead. And what kind of measures did we take at the community control? Prevention control at the community level is indeed an important aspect to cut the disease from further spreading. The strengthening of work in this regard have been a great help to the stabilization of the containing of the virus. Now let's refer this question to Mr. Yu. All of us are living inside certain community, so community is the grassroots and first defense line against the disease. The NHC has been acting according to the important instructions of General Secretary Xi Jinping, the Central Party Committee, and the State Council, as well as that of the steering group. First, we have put forward a series of specific measures at the community level in order to control the transmission. Premier Sun Chunlan, together with other steering group members, visited multiple communities to carry out investigations. Based on the reality we're facing, many important and effective measures were suggested. For example, the categorized treatment of the 4 groups of people. These 4 people refer to confirmed case, suspected cases, the fever patients, as well as close contacts. So it's a 5-to-1 scheme. So 5 people from different perspectives and different working positions are providing assistance to 1 patient. We also have locked down the living communities. We have also organized the party members of tens of thousands of medical workers to come to the community to conduct their work. This is important for us to conduct collective prevention and control and stop the transmission and protect the susceptible groups. Second, we've organized prevention control teams in order to supervise the efforts. According to the requirement of the steering group, the agency assigned CDC and community experts to work with the local colleagues to form this kind of preventive teams. Their footsteps are left in each street, each community, so as to establish accountability mechanism to find clues of possible cases and make sure of the implementation of important measures. The NGC also have assigned testing professionals as well as disinfection professionals to help with the nucleic acid test and labs, as well as the disinfection in key areas and public spaces. 3, we've organized powers to make use of IT and AI technologies to conduct epidemiology studies, which is the basis for the control of ID. We have mobilized our powers to carry out epidemiology studies, which is important to support the whole efforts. The NHC also act according to the requirement of NHC and have selected more than 400 epidemiological experts so as to help us with this endeavor. Fourth, strengthen technical guidance and publicizing of this important knowledge. We have compiled this manual on grassroots prevention control, on communities, quarantine locations, and public spaces. There are also specific and targeted measures as to specific groups and populations. We have also compiled the guidance on public prevention and psychological support. And endeavors are conducted through multiple platforms, including new media. These measures are widely applauded by the residents and have effectively prevented family cases from outbreaking. And coming up, we will continue to further our efforts in these regards and treat community level as the grassroots defense line and defend the achievement we have made and work with the local people and residents to fight and win this disease.
好，请继续提问。
好，谢谢主持人。我是中央广播电视总台
With CMG and CGTN, the Chinese expert as well as those from the WHO have conducted a field visit of 4 provinces, including Hubei, Wuhan, and have held a press conference in Beijing on the 24th. So what impresses these experts most during their field visit? We refer this question to Mr. Liang Wannian from the experts team of WHO. From February the 16th to the 24th, the panel of experts from the WHO took 9 days to visit Beijing, Hubei, Guangdong, Sichuan, to conduct field visit of designated hospitals, temporary hospitals, communities, as well as relevant departments and CDCs. They've been talking to government officials CDC experts, medical workers, as well as community doctors and residents. On multiple subjects and topics. And they were very impressed by what they have witnessed, and they have came to understand many important realities, and they have compiled a field visit report, which was made public during the press conference 2 days ago. And this report will also be made public very soon. During their 9-day visit, there are a lot of impressions, but they were touched by the following three aspects, impressed by the following three aspects. First, this is a completely new infectious disease which spreads fast and remain a lot of uncertainties. So far, no marketed vaccine can be used, and no medicines are proven to be a targeted or specific medicine to this. So the Chinese government have taken decisive measures to carry out this kind of siege against this disease. These preventive measures have been proven useful in a short 7 weeks, which have effectively curbed the trend of transmission, and thousands of people's lives have been saved. Also, we have built the first defense line against disease for the world. These decisive measures by the Chinese government were decisive and justified and effective. Second impression. With the implementation of the measures and changes of the epidemic, the preventive measures should be led by a unified organ and guided by unified instructions, but they also have to be localized and shouldn't be rigid. In this special time, we need to follow scientific evidence and evidence-based medicine to carry out region-specific measures. These measures have to be targeted and to the point. And these measures are also proven to be useful and effective. Impression number 3. The experts have felt deeply that these kind of non-drug related preventive measures are effective not just because of the leadership of the government, the work of all the professional organs and institutions, but it would not be possible without the participation of the people. The people in Hubei and Wuhan are carrying out the altruism with a unified spirit in order to form a synergy against the disease. The most traditional and original measures, plus the advantages of the Chinese systems, as well as the participation of the general public, and the Chinese culture, as well as the utilization of high-tech methods, have formed a very strong synergy And
也
that
是一个中国的
constitutes
经
the
验。
Chinese model,
谢谢。
which is has been
最后一个
proven
提
to
问。
be an effective, successful one.
经济日报中国经济网
Last
记者提
question.
问。我的问题是，中央近日印发
Currently,
了
the
进一
central
步
government
保
have
护
issued
爱护医务人
these
员若干措
measures
施的通
on
知，提
the
出了10个方面的举措。请问国家卫
caring
健康
of
委
the
在
medical
关心
workers.
爱护奋战在抗击疫情一线的医务人员
So,
方面，
what are
采
the
取了
measures
哪
that
些
are
措施？
taken
谢谢。
to safeguard the
新冠肺炎
interest of people, medical
疫情
workers
发生
working
以
in
来
the front line?
广大医务
Since
工
the
作者
outbreak,
在中央
under
统
the
一部
central deployment
指导
and
下
guidance, the
设想
medical
下
workers have
部大下
forsaken their
临危
self-interest
不惧
to rush to the
义
front
无
line
反顾地
to the
冲战
rescue,
疫情防控
and they
和
are a
医疗
defense
救
line
治的
between us
第一
and
线，
the disease.
展开了一场
It
感天
has
动
been
地的
a
生
heroic
命大救援，
battle to save
各地
lives.
累计派出
Altogether, more than
4万多名优秀的医务人
40,000
员
medical professionals
从湖北
have
武
came
汉
to
当地的医务
have
工
come
作
to
者一道
rescue to
争分
Hubei
夺秒
and
与
Wuhan,
病
and
毒
they are
展
racing
开了
against
殊死的斗
time
争，
to win
留
this
下了
battle
无
of
数
life. And
可
many
歌可泣的
stories
故事，
emerged
创造了
during this
一个
process,
个生
and
命的
many
奇迹，
miracles of life have been created.
有超过2000 多
More
名
than 2,000 medical
确诊
professionals were
感染新冠
confirmed.
肺炎，有
There
多
are
名医
a
生
lot of
护
doctors
士
and
以身
nurses
殉职，
have laid down their lives.
他们把自己全部的专业技术
They have dedicated all of the professionalities
以自宝
and
贵
their
生命，
energy or even their
献给
life
了金
to
主大
these efforts.
谱写了一曲
And they
震撼
have
人心的
been
抗疫
writing a chapter against this disease.
我向不幸去世
Hereby,
的
my
同胞
condolences are
牺牲的
with
医务
those
人员
that have laid
表示
down their lives
深切的
during this
悼念。
process.
这场严峻的抗疫斗争，是对新时代
In
医疗
this
卫生
cruel
工作
battle,
医疗卫生工作
the
者
medical
精神风貌
workers have showcased great spirit, professionalities,
的一次集中检验，
and it's a major
对多
task
年来
for them as well.
医学专业学科的
It
发展、
is also
技术的进步、应急能力的
a
提高，
demonstration
以及组
of
织
the improvement
管理工
of
作
the
的
medical capacity
集
of
中
our
的检
country.
验。医疗卫生
The
工作者
medical
向
professionals
党和人民
have
交上了
handed over
一张
an excellent
满意的
report
答卷，
card to the party
以
and to
实
the
际行
people,
动诠
and
释了
they have
敬有生
been
命、
interpret with their own
救死扶
behaviors
伤、
what does it
敢
mean
于奉
to
献、
dedicate
大爱
themselves
无
to
疆的
saving
崇
lives.
高精神，并进一步丰富了
And they
内涵
have enriched the
升
content
华了价值。
and have upgraded the value.
这种精神
Their
体
spirit
现在他
are
们长
witnessed
期以来以病人为亲人，恪尽
in
职守，
their high sense of
爱岗敬业，
responsibility and
体
diligence
现在他
in
们
workplaces,
对技术精益
and
求
have
精、
is also
知难
witnessed
而进，
in their
为患者
professionalities
解除
and
病痛
patience when treating the
体
patients,
现在抗击重大
and
灾
can be
情疫情
witnessed
的危
in
难时
their
刻。
in their commitment of putting themselves
越是在这
in
种
harm's
生
way.
死关头，越能折射出
At this
广大
critical
医务工作者
juncture, we can
践行初心、
clearly
不辱使命
witness
的
that
人格光辉。
they have been showcasing great
实践一次，
personalities
又一
of
次证明，
humanities,
这是一支政
which
府
have
坚定、
showcased that
技
this
术
is a
低廉、
team
优良、
with high
医德高
professionality,
尚、
working
党和
ethics,
人民
and
可以信
worth
赖的
trusting by the party
这是
and
一
the
支
people.
英
This is a
雄的部队。
heroic army.
这样一群人民群众健康的守护者，最可
They're
爱
the
的
most lovely people and the guardian of people's health, have won support and caring of the general
习近平
public.
总书记
General Secretary Xi Jinping made important instructions pointing out that medical workers are the
务必高度
central
重视
task
对
force
他们的
for us to win this battle, so we must strengthen our caring and protection for them, provide them with all the
中央应对疫情
assistance
工
that
作
they need.
领导小组印发关
The
于
steering
全面
group
落实
has
进一
issued
步保护
the
关心爱护
guidelines on further protecting
若干
and
措施
caring
的
the
通知
medical workers,
内容具体
and
实
the
在
content has been very
国委出
specific
台了
and
落实通知
pragmatic.
的指导意见，
And we are discussing with the relevant departments and localities to strengthen the implementation so that all the medical workers can feel the caring from the Central Party Committee and the government. As to the implementation of these measures, I will refer this question to Madam Zhao Yahui. The NHC attaches great importance to the protection and caring of the medical workers. We have already issued the documents on improvement of the working condition. There are several measures that are dedicated to that efforts. Under such a guidance, the NHC acted quickly with the relevant department to issue 11 documents and have taken measures, including first, in terms of salary and payment, we have issued policies for all of the medical workers in Hubei and those from the medical teams. We need to provide them with subsidies and double the standard of subsidies and double their increase their salaries by twofolds, and so as to make sure that this subsidy covers all of the medical workers. Ministry of Human Resources and Finance also have issued standards for subsidies. In terms of vocational safety, we have also issued documents to crack down illegalities so as to provide a safe environment. We also work with relevant departments to transport the much-needed medical supplies, to carry out training against hospital-acquired infection, and reduce the risk of infection in hospitals. For those already confirmed, we will give them the much-needed treatment that they need. We also provide them with the living necessities as well as hygienic products. And currently, the provision of these living necessities are also being implemented so as to make sure that they can have enough break. We also work with the local government to organize accommodations in nearby hotels. We have also arranged vehicles to help them to commute. We've also strengthened the rotation system. We have assigned 300 psychologists to provide psychological consult. We also give them preferential treatment in terms of promotion and salary, as well as support of their family members. The NGC asked that the working teams in different provinces strengthen their guidance on work in this regard so as to make sure that these measures are implemented. Last, I want to report an important information. With the commission of the Central Party Committee, the NGC will be working with the Ministry of Human Resources and the Administration of Food and Drugs. Will be identify a group of excellent groups as well as outstanding personnel. They will be rewarded, and this is only the first group to be rewarded. And this is a reward during wartime instead of only after this battle. And this work will continue as an inspiration to the medical workers so as to lift their spirit and encourage them to contribute themselves to this fight against this epidemic.
好，再次感谢几位发布人，也谢谢大家。
Thank you all for
今天的
joining
发布
us.
会
That's
到
all
此
for
结
today's
束
press conference.